Hello everyone, my name is Kristen Roney, Sales and Marketing Coordinator at Momentum Healthware. I'm here with Chris Olson, Director of Sales and Marketing at Momentum Healthware. So thank you all for joining us today. If you have any questions throughout the presentation, please feel free to ask them. And with that, I will let Chris get started.
Perfect, thank you, Kristen. Good afternoon, everybody. So as Kristen mentioned, my name is Chris Olson and I'm the Director of Sales with Momentum. And our goal for today's webinar is really to highlight some of the features that our RTLS in Motion solution has as it relates to our collective fight and combat against the COVID virus and some of the neat features that it has with infection control and infection management. So with that, I will kick things off. Firstly, though, I just wanted to explain what the acronym RTLS stands for and what it really means to Momentum. And what that is for us is our ability to understand exactly where your residents and your staff are in your communities. So we like to say that nurse call and traditional nurse call with pull cord stations, et cetera, is boring. And what we're able to do is really provide a current nurse call solution for you with pull cords and quarter lights and skilled nursing, but as well offer wireless pendants for your staff and for your residents that allows them with a wireless means of calling. So that allows them to request help anywhere in the community, and it also tracks their location as they go about their day-to-day lives. And that's really where the location reference comes in, our ability to know exactly where residents are. Every 3 seconds, we get a location update from their pendant, and you can really liken our system to a GPS or Google Maps for your community as you use our software. And why are location services in demand? We're seeing a definite increase in demand in our solution and some additional inquiries. And we feel it's obviously given the pandemic that we're all faced with right now. And obviously we're all living it. You know very well that the most vulnerable segment of our populations are in senior care, and I'm sure you're living that day in and day out. And our ability to provide that location tracking allows us to do some really powerful things for contact tracing, understanding interactions that residents have with other residents, with other staff members, doing some predetermined alerts, and really relying on the cornerstone of what our solution does, and that's with accurate location tracking. So that accuracy is 100% accurate to the room level, proactive every 3 seconds, really gives us that ability to do this contact tracing and get you that data so that you can really stop the spread of infection. Momentum Healthware as a company, we offer a full turnkey solution that provides you with the hardware, the software, the services, the installation, the training, the ongoing support. So we are the one vendor that comes in and provides that turnkey solution for you for your location needs, for your nurse call needs, whatever the different use cases you're looking to incorporate into your communities. So with that, I thought I'd focus in on the hardware itself for a few moments and just walk through some of the different components that we offer. The biggest benefit with our hardware and our partnership with a company called Centrac is our speed and accuracy. So I mentioned 100% accurate to the room level. This is very important to us, really important to our clients that use our system, because that's the only way that we can get that concrete evidence of contact tracing, of exactly where people are when they need help. Being able to understand location is important, and we need to be able to rely on that, and your care teams need to rely on that. The other really big benefit is low wiring. So we're able to come into retrofit perspectives, install our devices and our sensors and our pendants, be really non-disruptive to your residents' life. We're in their home areas for 5 minutes or less in their suites, and then we're out of there. So we're not really disrupting their home life. We're not ripping apart your ceilings and your walls trying to do wiring. It's really non-invasive from an installation perspective. So some of the components, we have resident and staff pendants. The pendants are either worn on the wrist like a watch, worn around their necks on a lanyard. Sometimes folks like to clip them to their clothing, but in all cases, the resident and staff would wear one of our wearable pendants. It signals their location every 3 seconds and also provides that large button for that wireless nurse call, emergency call. So the resident would push that large button when they need help. The pendant's going to give them an LED flash to signal that they did push it. And then it also has a vibration feature. So the resident's able to push that button. It'll give them that tactile feel, that vibration that they did push it, that the system heard them, that someone's coming. Our next component is our pull cord station. So I mentioned that we do provide a wireless nurse call. We do provide that functionality for communities looking to replace their nurse call, as well as location tracking. So we have a pull cord station you'd expect to see in bedroom areas and bathroom areas. Provides that pull mechanism as well as a 1/4-inch jack for any devices you want to plug in, any kind of standard healthcare devices that way. Next is our locator. So this is really the power of how we're able to do our location tracking. And we have a couple devices that do that. The first one is our TrueView locator. That is a simple plug-in device that we would go around your community and plugging in. They're plugged into resident suite outlets, hallways, common areas, activity rooms, essentially anywhere where we want to understand is a resident or a staff member in this room, in this space. It's nice that they can be plugged into electrical outlets. We don't need to worry about mounting those, but we do have battery pack options available in the event that there isn't an electrical outlet available for us. The second device is a location monitor. And again, this is another location tracking device that is watching for pendants. Essentially what these devices do is flash invisible infrared light every 3 seconds and communicates with that pendant. So the location monitor is just a very similar device as a TrueView locator, but used in larger spaces where we need a little bit more higher power light. So commonly seen in large dining rooms, large activity areas, different large groups like that where we have more people to sense, more coverage area that we need to quote unquote light up. The final two components are our repeater. You can think of these as an access point for our system. It talks to all of our wireless devices. We install all of these devices just directly into electrical power. So again, we don't need to worry about wiring or connection. We can tuck these away above ceiling tiles, hide them in electrical rooms. So we have a lot of flexibility in terms of where these are placed. And then lastly is our door guardian. So a lot of people liken this to a wander guard, which is literally what it is. It's our ability to understand if a at-risk resident is near an exit point, near a door for your memory care residents, your Alzheimer's residents, folks that need to have that extra layer of safety to prevent that elopement episode from occurring. And then all the things you would expect to see in a wander guard device with keypads to override, allowing for staff escort, features such as that. So now that you've got a flavor for some of the hardware components, thought we'd jump right in to the real topic of today's webinar, and that's how our system can help you in your fight against COVID-19. So there's three primary areas where our system and the power of our location tracking can accomplish this. The first is contact tracing. So being able to go back in time and understand where a particular infected person has been over time, get a detailed history of which other people they've been in contact with, how long that contact occurred, where those contacts physically occurred in terms of rooms and spaces. Also understanding where that resident's been historically. So maybe there wasn't any interactions with any folks, but you want to know which rooms they were in so you can go and clean those down effectively. The second area is social distancing. So our ability to, in real time, understand how many people are in different rooms and spaces if you want to establish any sort of protocols in terms of how many people are allowed in a specific space. Maybe you want to limit how many people are in the dining room or the chapel area, things like that. And then lastly is enforcing self-quarantine. So once you have a confirmed case in your community, we do have automatic rules that will allow you to ensure that that infected person is trying to stay put and self-quarantine in their suite. So alerts such as understanding when they leave their suite, folks that are coming in and out, different reminders that way. So we'll tackle the first one, contact tracing. That's, again, our ability to understand that location accuracy, being able to provide that accurate history of where folks have been, prioritize the cleaning of rooms that that person has visited. So what I'll do now is I'll just flip over to our actual software here and show you how we do that. So I'm going to open up our reporting suite and show you our infection control report. So in this example, I'm going to pick on a fictitious resident that we have named Bruce. Let's presume that he has become a positive case for COVID-19, unfortunately, and he was confirmed on Monday, we'll say yesterday. So from Friday until yesterday, we want to see what Bruce has been up to. So I'll pick the dates of June 26th to June 29th. Enter duration to establish proximity. This is our ability to either look at or ignore different casual interactions. So maybe just for argument's sake, we want to look at any interactions that occurred for 2 minutes or more because we feel that that would be a true meaningful interaction. From there, we would click on our residents, probably our staff as well. We want to understand if there's been any staff in contact with Bruce to see if they have any of the same signs and symptoms. And I'll run this report, and what this report will tell me is for this 3-day period, Bruce has been in contact with 10 residents, 3 staff members, and 4 locations. So immediately with a few clicks of your mouse, you're able to understand exactly what Bruce has been up to. You don't have to ask Bruce to try to remember where he's been. I can click these 4 locations. I can see that he's been in the dining room, the living room area, the chapel, and room 106. So if I was in a multi-floor community, I can see that Bruce hasn't left the first floor. Other than spending some time in his suite, he's been in the chapel, the living room, the dining area. So those are obviously areas where I would want to go and ensure that they were wiped down and cleaned to prevent any spread that way. And then I can sort the rest of this detailed report to see all the folks that Bruce has had interactions with. So I can see there's a number of residents that he was in the same dining room or living room area space at the same time. These are all the detailed interactions that occurred, so the date and time that the interaction started and how long the duration occurred for. One particular feature that we have that you might want to look at is really prioritizing the folks that had interactions with Bruce in his room, because the dining room is obviously a big space. Maybe Bruce wasn't sat at the same table as somebody, but if Rob Forgy was the nurse that entered Bruce's room, room 106 at different times throughout these days and had meaningful interactions, obviously Rob, the nurse, is at a high likelihood of contracting the coronavirus just because he was one-on-one with Bruce, presumably providing care to him on a one-on-one setting. So this would be how we do contact tracing in our system, how our reports are able to give you that detailed analysis of where Bruce has been, who he's been interacting with, hopefully talk to the folks that he has spent some time with, see if they have the same signs and symptoms. Hopefully they don't, and then allow you to really understand and prioritize the spread of that. Flipping back to our next example would be our social distancing ability. So within our system, we have live location views. So the first one would be our location list view. This is a location view that shows in real time where folks are. So I can see that there's a number of residents right now that have been spending some time in the living room area for the last hour and 13, 14, 15 minutes. So just from this list view, I can see that there's a number of folks. There's 2, 4, 6, 8, 9 folks that are in the living area. Potentially, I want to go and kind of break up the party, if you will, and make sure that people are being socially distant, not spending too much time too close to each other in case there is an outbreak. The other view that we have is our map view. So if I flip over to that, we can see the graphical representation of all of these 9 residents all congregated in the living area. So again, a nice visual sign that maybe we want to go and ensure that there's maybe a maximum of 5 people in the living room area, whatever your protocols or policies might be for those spaces, just to try to reduce the time that folks spend together. And then our third category as it relates to COVID-19 specifically, infection control, is our quarantine monitoring. So with this, we're able to set up predetermined rules based on the location pendants that resident's wearing. So let's presume that Bruce Wayne is our infected resident. Again, we can automatically alert your care team if Bruce were to leave his suite. So the second we see that resident leave their room, we can send an alert to the care team to politely go and redirect them. We can likewise set up rules that would alert you if another resident were to enter the suite. Maybe a friend of Bruce's going to visit, forgot that he was in self-isolation, and unknowingly going into his room. You could have those automatic rules, send a discreet message to your care team to go and separate them. And then thirdly, we can set up reminder messages that would just be a nice message to the staff members' smartphone that says, reminder, you're walking into Bruce's room. He's positive COVID-19. Make sure you're wearing your PPE or your face mask, other precautions that you have in your communities to prevent that spread to that staff member. And we can really monitor that via our reports again. So if I flip back to our reporting suite and I want to understand who's been in and out of Bruce's room, I can pick on his room, which would be room 106. And if I just want to go back maybe yesterday and see who's been in and out of his suite, make sure that there's been no other residents that have entered his room, I can quickly run this report. I can see that Bruce Wayne is the only resident that has entered room 106, but I do see that Rob and Stephanie were nurses, care team members that did go into his room, obviously to provide care and spend some time with Bruce as it relates to his care plan, which is perfectly fine and obviously allowed. Hopefully they took the precautions needed with PPE and other means, hand washing, to prevent that spread. But nice way for you to follow up historically and understand who's been in and out of that potentially infectious area. So those are a lot of our COVID-19 specific events, just given that they're topical, given the pandemic that we're in. Just really quickly, I'll highlight some of the other features that our system has as it relates to other use cases and functions. And primarily, these were the use cases used with our system before the pandemic really broke out. And the first is the personal safety and security. So obviously, when residents have that wearable pendant, they're not just relying on traditional means of requesting help via a pull cord station because they have their pendant. They can push the button on that wearable and request help anywhere in the community. There's going to be an alert that's sent to your care team that says resident Chris Olson needs help and the exact location of that resident. So it could be the hallway, the dining room, their suite, wherever they might be. Because of our location accuracy, we send that location of that pendant in our alert message so the care team member knows exactly where to go. Likewise, staff members would have their wearable pendant that they can use for staff duress. If there's ever an escalating situation where the staff member has an emergency, they can push their pendant and request a staff request. And then there's also some neat things we can do understanding those interactions, not just from an infection control perspective, but understanding how many minutes your care team spends with folks, automatically closing nurse call alerts when that staff pendant is with the resident pendant, some other neat things we can do to ensure that you have really accurate response times for all of your reporting needs. The other aspect of our system that is used heavily is for your at-risk residents. So if you have any memory care or early onset dementia residents in your communities, we offer the ability to prevent elopement through doors and elevator interactions, those WanderGuard type features you'd expect to see on exit doors or elevators, making sure that that resident is not able to elope. But then also because of our location accuracy, we can also create invisible boundaries for those folks. So maybe simple things like the residents often confused and going into the wrong resident suite. We can set up an automatic alert to alert your care team. In that example, if Tim is going into Bruce's room when he shouldn't be because he's disrupting the person that truly lives there. Maybe there's two residents that don't get along, they have a bit of a history, so Tim and Bruce, if they're in the same space together, maybe we want to separate them before there's an altercation. Different rules like that that we can set up, making sure that people stay in their neighborhood, stay in their lanes, so to speak, and everybody is happy. The other aspect of our system that's really popular is what it can do for your resident independence. So because we have that resident pendant, we're creating all these proactive rules for them. We can understand different discrete ways of creating alerts. So things like if a resident's walking down the hallway at 2 in the morning, that's odd, they're probably sleepy, groggy, at risk of a fall, they should be in their beds. Maybe you want to have an alert set up that would have your care team go and respond to them, escort them back into bed and see what they need. Some other things we can do is automatic attendance to activities. So if you have checkers every 10 a.m. on Tuesdays, we can automatically do a head count for those folks, understand how many people are attending those events, what's popular, so your activity director can keep an eye on things that way. And then another big thing that we do is really helping support what you're discussing with families about. So understanding how many care team minutes are spent with their loved one, what the response time is to nurse call requests, understanding level of care. So maybe in March you spent 150 care minutes with that person. Fast forward to June, and now it's 300 minutes. So it's important to understand that and be able to sit down with the family and talk about the health needs of their loved one, what that might mean for their care planning, for potentially their funding buckets, things like that, as their health needs are changing. And we're talking a lot about different alerts that come through from our smartphone app. So we essentially want to get these messages to your care team members. And obviously your care team is busy. They're not sitting at nursing station computers or stations. So we really want to get those alerts to their hip. We support a variety of wireless phones, pagers, but our most popular would be our smartphone app. So from that app, we are able to search for people by name, see that graphical representation on the map view that I shared, receive alerts, close alerts accordingly. So it's a very interactive software application on your smartphone that your care team would have that gets all of those alerts. So that was it for most of our presentation. We really wanted to quickly highlight some of the features that our system has as it relates to the pandemic that we're all faced with. And hopefully there's been some content that is intriguing to you, but maybe with that, I'll pass it back to Kristen and she can see if there's been any questions.
Thank you, Chris, for walking us through the presentation. So we do have a few questions. So the first one is, how many days can I go back into the system to view an accurate location of an individual resident?
Okay, sure. So essentially our reports are indefinite. So we can go back in time and there's really no practical limit on how far we can go back. Oftentimes we promote that we auto-archive the client's data every 2 years just from a database optimization standpoint, but theoretically there is no limit in terms of how far you need to go back.
Perfect, thank you. The second question we have is, will the system still work if the internet goes down?
Great question. Yeah, so our system is not reliant on the internet or the cloud. So we have an on-premise appliance that we would install in your community, and that ensures that in the event of internet loss, there is no impact whatsoever. We're still creating alerts. We're still receiving alerts from your resident pendants and your pull cords. There's nothing in the cloud or no reliance on the internet. And likewise, if there's ever power outages, because everything is battery powered, there's still the ability to receive all those alerts. So we really feel it's important to have everything on premise, so there is no internet reliance, that it's a life safety system in most cases, and you can get those alerts regardless of internet connectivity, regardless of power.
Perfect, thank you. And the last question we have is, how does one know when a nurse enters a resident room or a public area?
Yeah, great question. So the system would track their location just as it does for residents. So your care team members, your nurses, your residents, they'd all have a specific wearable that is unique to them, that's personalized with their name. So if Nurse Chris Olson is a worker in your community, I'd be wearing my staff pendant that's been programmed to be me for my shift. And as I go about my day-to-day life and my job, it would track my location every 3 seconds, see me entering resident suites, see me doing rounds, things like that. So just as we're able to track resident history, we can track staff history and staff location.
Perfect, thank you. So I think that's all the questions for today. Thank you all for attending. If anyone has any further questions, we're happy to answer them. You can contact us at contact@momentumhealthware.com. Thank you all very much. Have a good day.
Thank you.